So there are 12 pairs of cranial nerves which leave from brain and pass through foramina and fissures of this skull. And the name of these nerves are olfactory nerve, optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducent nerve, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, and the hypoglossal nerve. So now let's talk about their opening in the skull, function and components. First of all, we will discuss about olfactory nerve. It's a sensory nerve. It has sensory function of smell, and its opening in the skull is cribriform plate of ethmoid. So the second cranial nerve is the optic nerve. Its component is sensory. It helps in vision, and it enters into the skull from optic canal. The third cranial nerve is the oculomotor nerve. Its component is motor. It's a motor nerve. Its function is elevation of upper eyelid. It turns eyeball upward, downward, and medially. It also constricts pupil and accommodates eye. Its opening in the skull is from superior orbital fissure. So now fourth cranial nerve is the trochlear nerve. Its component is motor. It helps in turning eyeball downward and laterally. Its opening in the skull is from superior orbital fissure. The fifth cranial nerve is the trigeminal nerve, which is divided in three divisions. First one is the ophthalmic division, which is sensory. It provides nerve supply to cornea, skin of forehead, scalp, and the nasal cavity. And its opening in the skull is from superior orbital fissure. The maxillary division of trigeminal nerve is sensory, and it supplies skin of face, over maxilla, teeth of the upper jaw, and the mucous membrane of the nose and maxillary sinus and palate. Its mandibular division has both sensory and motor functions. Its sensory function is that it supplies skin of cheek, mandible and side of the head, teeth of the lower jaw, temporomandibular joint, and the mucous membrane of the mouth and anterior part of the tongue. But it also supplies motor function to muscles of mastication, mylohyoid, anterior belly of the digastric, and tensor tympani and tensor sacropalatinic muscles. The sixth cranial nerve is the abducent nerve. Its component is motor. It supplies lateral rectus muscle, which causes eyeball to turn laterally, and its opening in the skull is from orbital fissure. The seventh cranial nerve is the facial nerve. Its component is motor, sensory, and secretomotor. It is responsible for movements of muscles of face and scalp. So it has motor function. It is also responsible for the taste from interior 2/3 of the tongue and from floor of the mouth and the palate, which is its sensory function. And the facial nerve is also responsible for submandibular and sublingual salivary gland secretions and also secretions of lacrimal glands and glands of nose and palate. The opening for facial nerve in the skull is from facial canal, internal acoustic meatus, and the stylomastoid foramen. The vestibulocochlear nerve is the 8th cranial nerve, which is divided into two subdivisions. One is the vestibular division and the cochlear division. So the vestibular division is sensory, and it is responsible for the position and movement of the head from auricle and the semicircular canals. So the opening in the skull for both vestibular and cochlear division of vestibulocochlear nerve is from internal acoustic meatus. Cochlear division is responsible for the hearing, as it supplies organ of Corti. The Glossopharyngeal nerve is the 9th cranial nerve. It is a mixed nerve which has motor, secretomotor, and the sensory component. It has motor functions such as swallowing through stylopharyngeus muscles. It supplies parotid gland, which shows its secretomotor function, and it has general sensation of taste from posterior 1/3 of the tongue and pharynx, and it also supplies carotid body and the sinus. So the opening in the skull for glossopharyngeal, vagus, and the accessory nerve is through jugular foramen. So now let's discuss 10th cranial nerve, which is the vagus nerve. It has both motor and the sensory component. It innervates heart and the great thoracic blood vessels, lungs, alimentary tract from pharynx to splenic flexure of the colon. It also innervates liver, kidney, and the pancreas. Accessory nerve is the 11th cranial nerve, which is divided into cranial root and the spinal root. The cranial root has motor component, and it innervates muscles of the soft palate, except for the tensor valley palatini muscle. It also supplies pharynx, except for stylopharyngeus. Also it supplies larynx, except for cricothyroid in branches of vagus. The spinal root of the accessory nerve has motor component, and it supplies the sternocleidomastoid muscle and the trapezius muscle. So the 12th cranial nerve is the hypoglossal nerve. It has motor component, it supplies muscles of the tongue, except for palatoglossus, and it controls shape and the movement. Its opening in the skull is from hypoglossal canal. And that's the end of this video. If you guys have any questions regarding this, please leave them in the comment section. Subscribe Smart K3 Dentistry for more dentistry related lectures like these. Also don't forget to follow me on Instagram and Facebook at Smart K3 Dentistry. Thanks for watching, and I will see you in the next video.